Hi, I'm Dr. 𝒟, Chief Dermatologist at the Dermahouse. Today, I would like to address a condition that is frequently misdiagnosed, mistreated, and misunderstood, that is melasma. Melasma is a chronic pigmentary disorder characterized by symmetrical hyperpigmented dark patches typically seen on the face, affecting cheeks, nose, upper lips, and forehead. Unlike tanning or post-inflammatory hyperpigmentation, melasma is influenced by complex and multifactorial causes such as hormonal changes seen during pregnancy or use of oral contraceptives, ultraviolet and visible light exposure, then genetic predisposition, inflammatory responses, and heat exposure. Now, it is very important to distinguish melasma from tanning, which is superficial and reversible, and also from post-acne marks, which results from inflammation. Melasma, however, often originates from the deeper layer of the skin and tends to be persistent. Many patients attempt to treat melasma using home remedies or DIY solutions such as lemon juice, homemade acids, or turmeric. Unfortunately, these methods can lead to skin irritation, trigger inflammation, contact dermatitis, and disrupt skin barrier, which can actually worsen your pigmentation. Lemon juice has very low acidic pH. It can cause skin burns, and if applied on a skin exposed to sunlight, can be phototoxic. Turmeric, though anti-inflammatory, often contains colorants, and if applied improperly, again can lead to skin irritation and reactions. DIY acid peels or scrubs often lack dosage control and can lead to post-inflammatory hyperpigmentation. Effective melasma management requires multimodal treatment plan, combining evidence-based dermatological interventions, photoprotection, and long-term maintenance. At the Dermahouse, we follow protocol which may include treatments like 𝒾𝓽 𝒾𝓃 where it targets effectively the pigment melanin in your skin. Then medical peels, they helps in exfoliation and fades the pigmentation. Mesotherapy treatment involves delivering the pigment lightening agents such as vitamin C, tranexamic acid, and glutathione directly into the affected area. Melasma is a medical condition, not merely a cosmetic concern. Managing it requires clinical insight, patient compliance, and long-term commitment to sun protection. I encourage you to seek guidance from a board-certified dermatologist before starting any treatment. At the Dermahouse, we offer comprehensive skin evaluation to guide you for your correct treatment, depending on your skin type, pigmentation depth, and lifestyle. Thank you for watching.